But people choose those because the premiums are lower and it has everything bundled into one. So regular Medicare, their prescriptions are a separate thing and all of that. But with Medicare Advantage, it's all bundled into one thing and usually comes with silver sneakers. And so people like that. And it might have some other like fringe benefits that come with it. And that's why people choose those plans.
Welcome to the Colleague Down the Hall podcast. This episode is sponsored by the Collab Oasis Clinical Consultation Groups. Hi, I'm Janine Wolf, and I'm your colleague down the hall. I have a passion for helping fellow therapists get the clinical and collegial support we all need to do this work. And wow, it just keeps getting harder every day. I'm the founder and facilitator of the Collab Oasis Clinical Consultation Groups. I have been a social worker for almost 30 years, and I own a successful solo online private practice. More of us than ever are practicing in solo or online practices, and we all need colleagues to process cases with, commiserate with on those really hard days, and also to celebrate our successes with. In this podcast, I'll bring you insights about trends and changes in our field and sit down with amazing therapists who are doing amazing work. We'll discuss fictionalized cases, ways to practice sustainably, and of course, there will be plenty of laughing. I love laughing with friends. I'm so glad to have you as one of my colleagues down the hall. Hello, everyone. You are listening to another episode of the Colleague Down the Hall podcast. I'm your host, Janine Wolf, joined today by Gabrielle Juliano-Villani, right? A mouthful. Gabby is a licensed clinical social worker, consultant, coach, entrepreneur, and educator based in Sarasota, Florida. Today, we're going to talk about Medicare, what it's like to be paneled with it, and all the things. So many questions about Medicare for people who are trying to learn about it. So welcome, Gabby.
Thank you for having me back on a completely different subject than what we talked about last time.
Yes. You have lots of differing things that you offer and that you are knowledgeable about. So it's really cool to see the diversity in your business and the things that you do. It's very cool.
Thank you. I know I am definitely multi-passionate and I get that comment all the time from people. They're like, how do you do that? Like, that sounds like so much, but it actually works very well for my brain and I enjoy doing a lot of different things.
Yes, that's great. Yes, some of our brains function a little bit differently than the rest of the world.
Yeah, exactly.
Yeah. So, Gabby, tell us, you had a was it primarily or all Medicare, only Medicare-based group practice? Very successful. Tell us about that.
Thank you. So I started just Medicare in 2017. And quickly, how I started was I actually worked for Humana, the insurance company, and I worked doing in-home care management for their Medicare Advantage people. So I was already really familiar with Medicare and that population. And also, weirdly, my mom used to sell Medicare Advantage plans back in the day. So like, I have like this super weird connection. And Humana was doing a reduction in workforce, and I knew that my time was coming. And so, figuring out the next step, I decided to open a private practice. And one of my coworkers at Humana, who's still a really close friend of mine, kind of mentored me. And she said that she was going to start her private practice and take Medicare. And I was like, how do you even do that?
Right.
And I was like, but how? I need to get clients from somewhere. And I'm already really familiar with Medicare and I like working with this population. So I just, per usual, figured out and built the plane as I was flying it. And so
Yeah.
and I did it right. I did my application correctly the first time. So that was a good sign.
Right.
And because I, had such a specific niche, which we all know how important that is, I grew really quickly because I had made really good connections in the community and with other therapists that I worked only with Medicare and those clients. And I got full in this was also pre-COVID. Okay. So it was a different time then. So it was like 6 months, which is pretty good. And I had about 22 clients and quit my job at Humana and went into this full time. And then I just kept getting busier and busier. So One of my Zumba students, actually, who was a home health OT, said, "You should hire somebody, and I know a social worker who would be a perfect fit for your company."
Oh, wow. Doesn't get easier than that.
So that was really nice. And she was the perfect fit. And she actually stayed, she was my first hire, and she stayed with me through the sale of my business. So I hired her in 2019. And that went well. So I hired another person. And before I knew it, we were at 15 of us.
Wow.
And that was in like 2021. And we were still mostly Medicare. We did also accept Medicaid and some commercial insurance, but the community just knew us as like Medicare. So
Hmm.
it really helped me. That's why I love it. I'm pro Medicare. It really helped me build my practice, and they're great clients.
Absolutely. Yes. I also accept Medicare. And a couple of years ago, I was on all the panels because, that's what you think you should do when you start. Because I was flying the plane, building it while I was flying it as well. So I really enjoy working with Medicare clients as well. And so when I was choosing which panels to go off of, I decided to make a value-based decision. So I enjoy working with seniors. So I kept Medicare. And I live in a military community, have my whole life, so I accept TRICARE. And then we have a local insurance called Optima here that the teachers and city employees have. So I take that as well because I come from a family of teachers. And then I had room to open up a little bit for some private pay clients. So it's a little simpler too when you don't take all the insurances.
It does. It really makes it a little bit more simple. And that's kind of, it's funny because I started with just Medicare. And then as I grew, I was like, we're going to take everything. And then I was like, actually, no, we're not going to take everything.
Yeah, yeah, yeah. So in one of my groups this week, people were asking about Medicare because licensed counselors are going to be eligible next year. The thing that's interesting to me is that it gets a really bad rap for some reason. And I'm like, they pay consistently on time. I mean, and I've never been audited. I probably shouldn't say that out loud. But I also, it's just me. I have a very small practice with just myself. But I don't know why that if people confuse it with Medicaid, which can be trickier. But do you get that from people as well, that sort of
Yeah.
negativity?
And I'm glad that you're bringing this up. And I hope that everybody listening listens right now. And let me tell you, I had more problems with commercial insurance than I ever did with Medicare. And that is, you're exactly right. Like it does get a bad rap, and people are really afraid of it. I think because it's the government and it seems like this big, scary thing. And that's why I started doing Medicare consulting, because it's not a big, scary thing. It's very easy. The credentialing process is a little tricky, it's a little weird. But once you're in, the billing is very streamlined. You get paid consistently. Like there's really very few problems. And I think people also get confused between regular Medicare and Medicare Advantage, which are also two totally separate things. But I agree. Like Medicare is what helped my practice get to seven figures. It's what helped me sell it. And again, we worked with great clients and we loved working with those clients. It paid well, it paid quickly. And I had one recoupment, and it was our fault. And it was because we had a patient or a client who was in the hospital, and one of my clinicians that worked with me was seeing her, and she didn't document that and she didn't tell me. And so I billed and
Mm,
they paid. And then they were like, just kidding. This person was in the hospital. We're going to take back those two sessions. And
right.
so that's like the only like bad thing that ever happened. And it was our
Hmm.
fault.
Right, right. Yeah. And you can't really say that about many insurances, can you?
No, I mean, I think of the like when I sold and I had to like send all the paperwork and stuff to them, I had so much shit from Blue Cross Blue Shield of denials and like rejections and like all of these problems. Like I had a whole file for Blue Cross Blue Shield in
Oh,
Colorado.
wow.
And the Medicare file was very small. And
Yeah.
that's the other thing too is Medicare and Medicaid are two separate things, and people get those confused often as well, but they are totally separate and different, but they do come together sometimes. So people can
Hmm.
have both.
Right, right. And Medicaid is secondary to
Yes,
Medicare. Right.
yes,
Okay.
always. Medicaid is always going to be the payer of last resort. So that's a good way
Hmm.
to remember it.
Oh, yeah, that's a great way to say that. Okay, so do you want to tell us a little bit about Medicare versus the Advantage plans? The Advantage plans.
Yes. So this is the thing that gets people tripped up probably, I would say, the most and causes the most problems is that people don't understand the difference between the two. And when somebody is on disability or they become Medicare eligible because they're 65 or older, they can take basically two paths. They can get regular, traditional Medicare from the government, or they can sign up for a Medicare Advantage plan, which is also sometimes called a Medicare replacement plan. And regular Medicare is you bill like Medicare Part B to the government and you deal with them. And then usually people have, when they have regular Medicare, they have a supplement that will cover their 20% coinsurance most of the time. Or they'll
Yeah,
have
most
Medicare.
of my clients have that too. Yeah.
Yeah, that's most people do because it makes more sense because then they have no out of pocket costs, which is really nice for them.
Yes.
And speaking from somebody who has like a $7,000 deductible,
Yes.
that's a different conversation.
Oh, yes.
And then Medicare Advantage, I tell people like ignore the fact that Medicare is even in there because Medicare really has nothing to do with it. If you bill the commercial insurer who manages that plan and it has its own fee schedule, it has its own set of eligibility and deductible and coinsurance and copay, and they might have like a prior authorization that needs to be submitted or a limit on how many sessions can be done. So all of those Medicare Advantage plans are managed by the commercial insurer. You have to be in network with Medicare and the commercial insurer to bill those unless the client has a PPO and it has out of network benefits, which does happen sometimes, but they're a totally separate thing. They usually pay lower, they audit more, they are just generally more difficult. But people choose those because the premiums are lower and it has everything bundled into one. So regular Medicare, their prescriptions are a separate thing and all of that. But with Medicare Advantage, it's all bundled into one thing and usually comes with silver sneakers. And so people like that. And it might have some other like fringe benefits that come with it. And that's why people choose those plans.
Okay. Yeah. So that would be something to know because I think that's what maybe scares people a little bit because they don't understand the difference. And so they hear about people who are dealing with the Advantage plans, and it's not always a good experience in my experience. And so I think they sort of, lump that together with regular Medicare and think, oh, that's scary and awful. But really, if you're paneled with Medicare and you don't want to deal with those Advantage plans, then you just don't get paneled with those companies.
Yep. Yeah, you can make that choice and you don't have to. My practice didn't start taking Advantage plans until 2021, I think, like the beginning of 2021. And so we always just took regular Medicare. And for some people, we would bill out of network if they had an Advantage plan that had a PPO. So we would do that sometimes, but you don't have to accept the Advantage plans. And so that is the biggest issue that I see with therapists. Like you really need to understand the difference because your clients don't understand. They will call you
Right.
and say, I have Medicare and I have a United supplement. And I'm like, you do? What does your card say? They'll be like, it says United Healthcare AARP Medicare Advantage Plan. And I'm like, yeah, we don't take that.
So, and that's a good way to like show me your card or read me what's on your card. That's a really simple way to resolve that.
Yeah, I did that with everybody. And, because they didn't understand. And sometimes I would ask people 2 or 3 times and be like, no, it's a supplement. And I'm like, can you just get your card? And like, oh, my wallet's all the way on the other side of the house. I'm like, that's okay. I'll wait.
Right. Yeah.
No
And
problem. How's your day
right.
going? And then they'll start chatting. Then they'll get their card and they'll be like, it says Humana Gold Choice Plus HMO. And I'm like, yeah, we don't accept that.
Right. And most people in general don't understand health insurance. And So we have to do our due diligence as providers. We can't assume that they're going to know all of the things because most of them don't, and they don't really even care. They're used to showing up at a doctor's office, presuming they accept your insurance, and you go about your business. And it's not always that simple.
Yes, and that's always a good reminder too, because since like I kind of grew up around it because my mom did so much work in that field, like I had
Hmm.
always really understood it. But it's funny because like my husband has no idea. He just gets angry. He like, doesn't appreciate it at all. And I'm like, I'll take care of it.
Yes, yes, yes. And one of my children, well, the second of my children that aged out of being eligible for our insurance plan has been learning all the ins and outs of all of that. And, and I'm like, you will do yourself a favor by learning what's what. And so you know what to expect and what's covered and what's not, and what all the different things are, premiums and, copays. And now there's copays and coinsurance, and insurance companies are not accepting copays as going towards your deductible. There's all kinds of things that I'm learning from some of my clients, even that like they can renew the plan that they already have for the coming year, but the plan might be different. They might have made some changes that you don't know about. You think you're just signing up for the same thing.
Yeah. Yeah, it's all very tricky and that just adds to the complexities, but if you just, I think it's really about like this is what I say when people are talking about the credentialing too. Like it seems so overwhelming, and so I made like a checklist of things you need and where to go and all of that. And just like with anything new, it is overwhelming because it's new and it's
Mm-hmm.
uncomfortable. But think about what works best for you. So for some people, it's like they just need to set aside 90 minutes and just sit down and do the whole thing. Or, say for the next 3 weeks, I'm going to spend like 20 minutes every week on this and just see where I get. And then you can break it down into little chunks and it doesn't feel so overwhelming when you're applying because you do it all online and it'll save your place. And yeah, it's just about doing some research and getting the education around all of these things because yes, there's a lot of changes and things change and you still might not know. That's also the
Right.
reality.
Right, right. Yeah, and I would add keep a notebook, because a lot of times people are paneling with more than one insurance at a time. And so I learned very quickly I needed to have the date and time that I spoke to someone, and when I faxed something or emailed something, because sometimes, and this is not specific to Medicare, but sometimes things get lost in the system, or I sent an email to the wrong department. They didn't forward it to the right department, and they didn't let me know it was the wrong department. I had to call in a few weeks later. I was like, oh, that's so helpful. Thank you.
Keep track of everything, document everything because having that information is really helpful. And then for you too, like, oh yeah, I did call about this and I totally forgot like 2 weeks ago and I never heard anything.
Mm-hmm.
And the other thing is like, just not even just with Medicare, but with anything with your business, keep all the paperwork, keep it in a folder or scan it on your computer or on an external hard drive. Like, you will need that stuff eventually. Kim and I were talking about this. We did a live in her Facebook group this week about Medicare. And she was saying like she needed that letter from the IRS for her EIN and she couldn't find it. And she had to get a new one. And it was a whole long thing. I'm like, those are the things you got to keep. And I can't tell you how many times like I've done a consulting session with someone and we're just trying to like, we spend half the time resetting their passwords because they can't remember them or whatever.
Yeah.
So like, try and just keep all that stuff organized because it will really
Mm-hmm.
make your life easier in the future.
Yeah, absolutely. And something that I find with a lot of therapists is that they don't think of themselves as a small business owner. They think of
Yes.
themselves as a therapist who works for themselves. But you have to know how to run a small business. And there's small business associations everywhere that are free and very resourceful and very helpful. But I will do trainings and I'll say, raise your hand if you have a small business. And none of them raise their hand. I'm like, guess what? You have a small
You
business.
do. All of you do. And that is so important because that comes up a lot too. You are running a business, and the SBA, by the way, is a great resource. I actually did executive coaching for them, and they have so much stuff out there that can really help you. But yes, you are running a small business. Like if you went to, I don't know, the flower shop down the street and they like had just random shit everywhere. Like you'll be like, what is happening in here?
Yeah.
Right? You
Right.
like think of it as your practice too. Like you got to have some organization. And even when people ask me about selling, somebody asked me this today, like, how did you sell your practice? Well, it's a very nuanced answer that I can't really say in like a minute, but it really comes down to being profitable and growing in a sustainable way. And a lot of that had to do with being organized and being on top of things and knowing my numbers and making sure I was doing things right and that I was always working on my business and doing marketing and things like that. So, and that connects back to Medicare because Medicare is actually partially what attracted the buyer to me. So that was another perk for me too.
Yeah, yeah, that's wonderful. Yeah, and I talked to people who some this group we were having, they were talking about whether or not they wanted to take Medicare, and I said, well, you also need to be thinking about your clientele, because if you're working with adults, and if you especially if you're providing more long-term type of a therapy, they could age up and be in Medicare, and all of a sudden you can't work with them. And is that okay with you or not? So what is your population, and what is the chance that you're going to be encountering that in different ways that you didn't really even anticipate?
Yes, that's a very good point because I see that happen a lot too, where they are working with somebody long term and they do get on Medicare and then there's like a disruption. Or, somebody the other day was like, I was asking me if she should take Medicare. She wanted me to help her with it. And she's like, I don't really know if I want to work with those clients. Like, if I want to work with the elderly or disabled people. And I'm like, well, you don't have to market to Medicare. But if you work with, she works with women who deal with anxiety and relationship issues, and like then you market to that. And if somebody
Yeah.
has Medicare, then you can see them. Like you don't need to specifically market to the Medicare population. You can still market to whatever your niche is, and then that just
Hmm.
opens it up, right? So if somebody does call you and they're getting divorced and they're in their 70s, then maybe you could work with them if you wanted to.
Right. Yeah. That's a good point. The thing that I find interesting, and I'd love to hear your thoughts on, therapists pay companies a lot of money to get them paneled on with various insurances, which I find interesting because to me, the hardest part was getting all the information in one place. And you
Yeah.
have to do all that, all the numbers that you need, and NPI and EIN and all those things. And once you've done that and turn that over to the company, I sort of like, well, you could just do that online and hit send and be done. And so do you see many people who go that route?
Yeah, a lot of people want to outsource it and pay. Like I was just talking to somebody this week and she was going to pay somebody $250 to do it for her. I was like, you could do that. Or, if you think you can do it yourself, my course is like way less than half of that, and it'll tell you how to do it and your time. Like, so that's something to think about too. Some people I think do find it very overwhelming, but I really feel like we build it up so much in our heads and we overthink. And again, like if you just have all your stuff, right? Like your MPI and, I had it all in a Google Doc, so I could just copy and paste it. And that makes it much easier. And the application really doesn't take that long. Like I've helped people do it in 30 minutes. And I know if I was probably doing it just for myself, it would probably take me like 20 or 25. There's some weird questions. Like there's one about where you keep your medical records, and people tend to overthink that. And they're like, well, is that Simple Practice's address? Where is that? I'm like, well, you're not keeping it at Simple Practice headquarters. Like, where do you keep them? Is it in your house or is it in your office? That's the address that they want. So like
Right.
there are a couple of like weird questions like that, but honestly, it's pretty straightforward. It's all online. I imagine that so I've heard that, well, first we heard that it would open up the applications for LPC and LMFT in November, but a couple of those got rejected. So I'm telling people to just wait right now and see what happens. But so I imagine in January there is going to be a high volume. It's going to take longer. But I have seen Medicare applications get approved in 3 days, and I've seen it take like an average is probably like 2 to 4 weeks, but it's usually not that long. It's pretty fast.
Yeah, and that's another benefit to Medicare over some of the commercial insurances, because they can take a really long time
Yeah.
for some of those.
Like Aetna and Humana literally took over a year for both of those.
Oh my gosh. Wow.
At that point, I was already like selling my practice. So I was like, whatever, this isn't my problem anymore, I
All
guess.
right.
I tried.
Yeah. 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 So they are going to, when it opens up, so they typically you have to do like in the open enrollment period is in like November typically, but since they're opening this up to them, they can apply at any time.
Yes, you can apply to be a Medicare provider at any time. It's not like a closed panel or anything like that. The open enrollment is for beneficiaries who are signing up for Medicare. So you can, as a provider, you can apply anytime, and allegedly January 1st is like when it'll be
Yeah.
okay for LPC and LMFT,
Hmm.
because I
Yeah.
know, when we're recording this, it's like the middle of November and a couple people have already gotten rejected. But I also heard that maybe in December. So I
Okay.
just, join my Medicare group if you want. I post updates in there and I'll
Hmm.
have more information about when that'll be available for you to go in and apply.
Yeah, good. Yeah, I sent them to your Facebook group.
Thank
So
you.
if you got a couple new members this week, they were
I
coming
have
from me.
gotten so many new members this week, and I don't know, like there's been like I did a live with Kim, and then I talked about it in another group. So I think it's just the timing is like, okay, like January 1st is coming, and if I want to accept Medicare, like now's the time to start knowing when.
Yeah. Yeah. Okay. When I was talking about open enrollment, I was thinking about that little postcard they mail me every year. I think that's just if you want to make changes.
Yeah.
Because
Yeah.
whatever I did when I first applied, I was getting a lower rate. And they told me that it was because I didn't do some 38256I form or something like that. And so they said I had to wait till November. And I don't, yeah, it was years ago. So
Oh, hey, yeah, that's really weird. I haven't seen that before.
I don't, yeah. And I don't even know how I knew that, but I ended up calling in and they set me straight. And they're pretty easy to get in touch with too. I haven't found that you're
Yeah.
on hold for hours either.
That's the other thing is that we all have this preconceived notion again that because a lot of commercial insurance is like that. So we think like, oh my God, calling Medicare, it's the government and be on hold for hours. And that's usually not true. And they're very helpful. And even like I've had to call with very specific questions and they were able to answer them for me and quickly. So
Yeah. Yes, that's a good thing.
yeah, and unusual.
Yes. Unlike HP, who I tried to get some computer support with. Oh my gosh.
Oh, God. That is, I needed them to help me with my printer a couple months ago, and I was like, forget it. I'm just gonna buy a new printer. I don't care. I can't deal with this.
Did that last year. I was like, my whole system with my consultation groups, it's color coded for all the different times that the meetings meet.
Yeah,
And it wouldn't print color. I had to keep resetting it, disconnecting it, resetting. I was like, I literally have to have color. Like it's not optional.
that's like the
Because I was,
one thing that I need.
yeah, yeah. So I waited for a Black Friday sale and I was like, I'm getting a new one. Just going to be done with it.
Sometimes it's just easier to do that.
Right. Yeah. Okay. All right. So what are do you have any other thoughts or tips for the counselors who are, thinking about doing this?
So, one thing that I say about a lot of things, not just with Medicare, but it's very easy to get caught up in the negativity and the negative posts. And
Hmm.
just a reminder that what you see on social media, right, is like a very small glimpse. So, even in my group, there were like three people that were being audited at the same time. And so those posts were getting a lot of engagement because fear.
Yes.
And so they kept, the algorithm kept showing them to people and it was really freaking people out. And I'm like, well, you know, like yes, that can happen. You can get audited at any time for anything. And that's why I have a note template and courses and all that stuff to help you and guide
Hmm.
you. But out of the, there's three people posting about getting audited, and there's 2,100 other people who have never been audited just in this small group. So I would just encourage you to think about that. Like, that's only one piece of it.
Yeah.
And I also am very big on values. I talk about that all the time in my coaching and my burnout prevention training. And so I think that's really important too, is like, what do you want your day to look like and what kind of clients do you want to see? And if Medicare clients fit into that, great. And if they don't, great. Like that's fine, right? It's not for everybody, but it has been a really great, or it was a really great income stream and revenue stream for us. This is the fastest growing part of the population. And so these, depression and anxiety is not going anywhere either in this world. And
Right. Yeah.
and so there's a really, really big need. And that is partially why my practice grew so big so quickly, is because there weren't very many Medicare providers and there were more clients than we could handle, even. And I think that's just going to continue to happen. So, that's something to think about too, is that again, like that's good job security if you enjoy
Yep.
working with these clients. And what else would I say? I guess the other thing that scares people is the auditing, which I just kind of briefly touched on. And again, that's a really big, scary thing that we build up into our heads. And it could happen. So it's better to just prepare for it. I've passed a Medicaid audit with my group practice, which was very anxiety inducing, but I used my note template and I had everybody trained on how to do it. And we
Yeah.
passed and we were fine. And Medicaid is a little scarier than Medicare to me. But yeah, and most of the people in my group who have been audited passed. And the audits are not just, by the way, they don't just like come in and look at everything and they're like, this is horrible, we're taking back all of our money. They look at it, and if there's problems, they tell you what the problems are, and they say, we're going to come back in 90 days and we want this fixed. And if it's not fixed, then they have like a second level where they do training with you. So it's not like they just come in and just immediately recoup a bunch of money. They actually want to help you.
hmm Yeah. Yeah. Early in the very beginning of my career, I worked for a pediatric hospice and we had a home health side as well. And so we had the Medicaid audit every year. It's very involved and very scary.
Yeah.
And they would always do it like the second week of December, which was a very busy time.
They always do that. They do that in Colorado too. Like they always start auditing around like right around this time. And I'm like, why? Why? I just want to enjoy the holidays.
Yes, absolutely. So this has been really helpful and insightful. I hope that the people listening are going to, maybe it'll mitigate their fears a little bit. I do so agree with you about social media. People tend to complain more than they praise there in therapist groups anyway,
Uh-huh.
which
Yeah.
boggles my mind. So hopefully this will be helpful. And so tell us about, you've got a Facebook group. Tell us about the name of your Facebook group and the other resources and things that not just related to Medicare, but all the other things that you do.
So if you want Medicare help, it's Medicare Consulting for Therapists.com. And the Facebook group is the same name, Medicare Consulting for Therapists. And I have courses, and if you're not ready for that, I also have tons of blogs on my website that are really helpful, that tell you like all the main questions that I get all the time, like about where to find fees and stuff like that. There's also a bunch of videos in the Facebook group that you can watch, and we have tons of pinned posts as well that go through and explain everything. And then I also do one-on-one consulting. And then if you want my note template or any of my other checklists or forms to help you streamline your practice, those are on Etsy. And that's gjvconsulting.etsy.com. And then the other stuff that I do is I help people scale beyond the one-to-one, either into a group practice or by adding additional income streams. So I do lots of business coaching. I've coached for the SBA. I also do training and coaching on burnout prevention using polyvagal theory, and I run retreats on that also. And then I do sound healing and intuitive readings, and all that stuff is on GabrielleJuliano-Villani.com. And my other Facebook group is called Create an Abundant Group Practice.
And you teach Zumba.
And I also teach Zumba. We can't forget that.
That's right.
And actually, Andrea Bragnano was like, you should do like a therapist Zoom, Zumba. So I think I will do that because I really
Oh, that
like
would be so fun.
it, and then everybody can just do it virtually. So
Yeah, that would be a lot of fun. Yeah. I haven't done any of the coaching part that you do, but I've participated in sound healing with you. I sat through an exceptional presentation that you did in Costa Rica last year about burnout prevention and polyvagal theory. You're all over the place with that. And it's so helpful for people to understand that and see how it relates to all the things that we deal with in our work that are hard, which is
yes,
pretty much everything we do in our
every
work is hard.
it is. It is. And that's why I talk about it is because, yeah, like and I think obviously the conversation is changing a lot, but when I started as a social worker, everybody was just like, oh, there's a lot of burnout in social work. So make sure you take care of yourself, set some boundaries. I'm like, what does that mean? Like, how do I do that?
Yeah,
Why do I feel this way? And so I wanted to go deeper, and I appreciate you saying that. And I'm glad that it resonated with you and that you were there and I met
I
you.
know. I know. Start of a friendship.
Yep, exactly. The power of retreats and conferences and going to in-person events like that, you always leave just refreshed and with new people in your life.
Absolutely. And pretty exhausted too.
Yeah, we
We
did
had
a lot.
meetings half the day and then a lot of fun later on. So I was pretty tired when I got back.
We did a lot, but it was really fun. And I have
Yeah.
really good memories of that trip. It was awesome. But I
Yeah.
also, that's why I stayed for 2 weeks because I need to decompress after. And I'm doing the same thing I'm hosting my first retreat in January in Belize. That's sold out. And
That's amazing.
thank you. I'm trying to you know, be confident about that because it is sold out. And I'm staying an extra 5 days afterwards too, because I'm like, I'm gonna need to just like rest after this, but I know that about myself now. So,
Absolutely. Okay, so I'm going to put you on the spot because I forgot to remind you of this before we started. Do you have a favorite catchphrase or analogy that you like to use?
oh, I have a couple. I like that perfection is the enemy of good enough.
Mm.
And I always say this to my friend who she's in a different field and is kind of like my business coach slash mentor. The riches are in the niches, except I say niche, so it doesn't really work, but that is an important thing to remember too.
I say niche too.
So it depends how you say it, but it is important when you're thinking about scaling and offering other things. We
Yeah,
hear this all the time, right? Like how important it is to niche down, and it really is. So I always
yeah.
have that one in the back of my head too.
Mm-hmm. Yeah, and absolutely. And the whole additional income stream, we are so well prepared for that in our field, because we know our stuff inside and out, the population that we work with. So people are writing books and workbooks and doing trainings and offering consulting and all kinds of things, which is such a great balance to doing the one-on-one work with clients.
It really is. And I appreciate you saying that too, because I hear a lot that it's like there's just kind of a narrow focus. And a lot of therapists are like, what else would I do? And I'm like, listen, if you have a hobby, first of all, I can monetize it. And second of all, anything that you like doing, I will find a way to add things in there. Like just like you
Yeah.
said, like trainings and workbooks and consulting, and we can really offer so much, but we get stuck in our heads that like I'm a therapist and I can only do therapy. And there is a whole another world out there of people who need to hear what you have to say because they know nothing about it. But we think because we're surrounded by therapists and clients all the time that oh, everybody knows all this, but it's not true. And what we do translates very well to so many other fields out there who need our help.
Yeah, I agree. And you have 18 income sources? Is that what I heard I saw you post about that recently.
I think last time I counted it was like 15 or 16
Okay.
or 17 or something like that. There is a lot. There's
Yeah.
a lot. We keep track of them. And the other thing I will say about that is that it pays me more, so I work less. So like if I do a training, that is the same as in the past when I was still doing therapy. That might have been like seeing equal to seeing 10 therapy clients, but I did that in one training in 1 hour. So
Right.
I how it balances out. And that is exactly why I work the way that I do now.
Hmm. Absolutely. Yeah. And I think another thing that holds therapists back is that I think so many of us set the bar really high for ourselves.
Yeah.
And so then you get that perfectionism thing, like you were talking about a minute ago, and then you get fearful. And even like the marketing, I had totally stuck in my head about the marketing. When I transitioned to fully online in 2019, I took a marketing class because I was like, okay, I'm going to have to market differently with this. And once the person was like, you know, you talk to your clientele about their issues every day. You know exactly what to say to attract the right people. And I was like, you're exactly right. We
Yes.
do know exactly if we can get over our fear and just start like jotting down notes and, just all the things that we know, gathering it together in one place and use it for marketing.
It's so true. We do know, but we get in our heads, and it's the perfectionism and it's the fear. And even I was searching in Thriving Therapists and Megan Smith Gunnell's Facebook group. This was like a while ago now, but I was looking for something and I found a post that I made at the very beginning of like 2020 or right around the pandemic. And it was totally this fear-based thing where I was like, I'm really afraid that, Medicare is going to become insolvent and I'm not going to have any clients and my whole group practice is going to fail. And I wanted to like go back to Gabs in 2020 and be like, listen, stop. You need to stop because actually what's going to happen is your group is going to have 7 figures in revenue and you're going to sell it and you're going to be living your dream life. Just like hang on and stop thinking that way.
Right.
And it's huge. And a lot of people, I'm sure you have the same thing, Janine, like a lot of people will come to me for consulting and they're like, I really need help with the logistics. I'm like, you don't need help with the logistics. You need help with your mindset.
Yes, absolutely. Absolutely. Well, Gabby, thank you so much for coming back on. You have another topic I'm going to be hitting you up with sometime in the future that we can discuss. You can just be on like every other month, maybe.
I love talking with you. I am so grateful that you are in my life and that we met in Costa Rica. And I am happy to share with your listeners. And yeah, if you need Medicare help or any of the other things, you all know where to find me now.
Absolutely. And I'm going to put all those things in the show notes so they'll be easy for people to be able to find you. So, for everyone listening, there are new episodes of the Colleague Down the Hall podcast released every Thursday on all major platforms. Please remember, our work is hard, but it doesn't have to be lonely. Thank you so much for listening to the Colleague Down the Hall podcast. For show notes, links, and downloads, head over to colleaguedownthehall.com, where you'll be able to learn more about getting the clinical support you need and resources to help you work in a supported, sustainable way. If you've enjoyed this episode, please share with your therapy friends and colleagues. Subscribe to the podcast, and if you love this episode, please leave a review.